Here to answer some common questions tonight on the virus and how to treat it is Dr. Aekta Miglani from the University of Rochester Medical Center. She is the Director of Emergency Care there. Doctor, thanks so much for joining us.
Thanks for having me.
You know, you just heard the governor say it.
Yeah.
There's so much fear out there right now. Is it warranted?
So I think people's fear is very understandable based on the amount of information that's coming towards everyone from all different angles. But I think it's also important to have that layer of perspective, which is we're going to be fine. There really is no reason to panic. I think the symptoms that are associated with this illness are very mild for the vast majority of patients.
Okay, so let's go. Well, first of all, I do want to interrupt for one moment and let people know that we are waiting for a CBS News special report any moment now. So if I have to stop the interview and interrupt, we're going to do that. But let's continue. So we talked a little bit about symptoms. What are they? What is this coronavirus illness like?
So they're very much like any other cold or flu-like illness. It's a cough and it's a fever for the most part. I think, again, it's important for people to realize that actual flu, influenza itself, the symptoms are probably much more severe and much worse. These are very mild symptoms for the most part.
But the concern here is that it spreads easily and it can kill you. There's no vaccine. We have to contain it, right?
I think that containment is certainly one of the major efforts and one of the major priorities that we have to approach in this situation. But I think there's also a level of common sense in terms of when you have symptoms that are very helpful, and that's when you're not feeling well, when you have a fever, not going to work to limit exposure to other people, which is just true if you have the flu or if you have a cold also. Right. I think a lot of hand washing. I've seen way more elbow bumps and fist bumps than handshaking than I ever have before. I think that's fine. And I think just recognizing that if you're generally feeling well, if you have a cough, if you have a mild fever, there isn't necessarily the need to go to the emergency department, to go to see your primary care doctor. I think using the online resources, including the CDC and Department of Health websites, are very helpful. And touching base with your primary care physician about what's going on is important. But for the most part, it's going to be staying home, taking care of yourself. Lots of fluids.
All right. We could talk forever, but bottom line is you're prepared. You're prepared.
And I think that's the other piece, is that University of Rochester has been having lots of planning meetings about this. Everyone is very prepared. There's lots of different services involved. We're ready.
All right. Dr. Aekta Miglani, thank you so much for joining us.
Thanks.
We'll send back to Adam now before we talk about the cruise ship, Adam, that's carrying some 3,500 people and 21 cases of the coronavirus.